All right, Michael, thanks for coming on with us today. Uh, PRI is something a lot of people may have heard of, may be familiar with, may have seen in some strength and conditioning settings and things. And Mike, how did you get into this, and what brought you to go so far into this treatment strategy or system of getting people better?
Well, first, thanks for having me on. I appreciate it. I'm excited to share some thoughts and ideas. So a few different things. Number one, so my background is, a certified athletic trainer and physical therapy assistant. But I am a lifelong student of the human body. I am educating myself every single day. Currently, I have people out of my practice that I see out of my own business, where I see people who, many of them just have a lot of complicated, complex, chronic issues. But my background prior to that was just working in outpatient physical therapy. So during those times where I was taking continuing education programs and learning as much as I possibly could all the time, I began to realize that there were a lot of things I was observing and seeing that weren't answering questions that I had. I didn't understand when people were supposed to breathe during certain exercises or activities. I didn't have answers, or I couldn't find answers as to why people were presenting with imbalances and asymmetries and compensations, changes in the way that their structures would present to me. I'm a very hands-on, manual-based practitioner, and I would feel things and sense things. It just didn't make sense based upon the traditional exposures that I had to other representations and other models. So what the Postural Restoration Institute demonstrated to me when I took my first course back in, it was either 2000 or 2001, it was very early in the Institute's origins, was the first time an organization had kind of put together concepts and ideas that kind of answered some questions and filled in some blanks and looked at things from a more systemic element, more than just a very, more myopic or very focused view about a knee being a knee and a hip being a hip. Looking at the way that the internal dynamics of the way that the body biases itself and positions itself, and the way that we develop different strategies to manage day-to-day life and activities and gravity and things like that, begin to kind of create issues with people. And so as I took my first course and left and said, well, that was completely different. That was not at all what I'm used to seeing, and people understanding and appreciating that the two sides and the body and the brain don't work the same way. That started me being intrigued with what else they had to say. So I just started, observing more with the people that I worked with the patients that I worked with at the PT place, doing more of their assessments and trying to just figure out for myself, even if I didn't know what I was seeing, just doing the assessments just to try to see some, similarities or correlations with what I was being presented with. And so I would be more and more intrigued the more I realized, like, holy cow, yeah, I do see this often, or wow, this does represent, what it is that I hadn't ever considered before. And so it got me thinking and exploring more about the coursework, learning other things from other representations and other disciplines, if you would, kind of looking outside of just what the coursework offered to try and say, hey, how much is out there that demonstrates or discusses these concepts? And there's a lot out there. And what the institute has done is done a pretty amazing job of pulling together a number of different disciplines and finding information and the people and the concepts that are the outliers to the traditional model of thinking, and kind of recognizing that there is a correlation between all of those different disciplines and those outliers, and how it can represent something about the way that the human system has grown to develop over time, and different imbalances and compensations that are kind of consistent. And then what they've done is developed this assessment model and this treatment algorithm of sorts to try to help to manage some of the system's normal imbalances and be able to have people be able to create an intervention strategy, as well as a day-to-day lifestyle change and re-education that allows people to begin to say, oh, so I got to make some changes, like the client that just left here. I got to make some changes about how I orient myself and position myself to have this stuff be just that much more effective.
Yeah. So I think people that are familiar with Postural Restoration Institute think it's laying on your back and blowing into a balloon, and that's what it is, and putting your legs up on the wall. So um, I know that PRI isn't just that. I think that's a strategy you guys used. It was like one of the first things that came out, or one of the bigger things that people could start to use. But what is PRI, or postural restoration, actually trying to do? Because there's kind of a whole anatomy component, there's a neurology component. So, what are we trying to correct, or what are we seeing that we're trying to fix?
So a few different things. Number one, and this is just me being a little particular about words at times, not fix anything. To your point, I'm not giving you a hard time, but do you know what I mean? But it's
Yeah.
how do we get the brain and the body to manage, to understand and appreciate and recognize the way that the system has certain inherent biases in every single person that I've seen, and I've been doing this a long, long time, and I've seen a lot of bodies. The way that the normal internal imbalanced dynamics of the way that our body does stuff by design, by design, and how some of these underlying internal mechanics can create layers of compensation, strategies, if you would, that the brain and the body put into place to manage these little internal things that we don't even recognize are happening a lot of times, and the way that our body has then adapted them to day-to-day life, which can be sitting at a workstation or it can be playing sports. And that whole spectrum of things in between that we begin to kind of stack on and layer on that create more and more layers of these compensations. And these become then adaptations that now they're ingrained in our brain as well as in our physical structure. And so to go outside of those imbalances that we've adapted to feels wrong. It feels odd. And so the brain just is like, don't go there. It just doesn't feel right. And so then we continue to kind of feed forward into these imbalances. So what the Institute's concepts and what I mean, I'm speaking for myself. You know what I mean? Like I'm certified through the Institute, but I'm always speaking for myself. What I'm trying to manage is get the body and the brain to learn to say, by the way, this little bit of an imbalance that you have here, this poor positioning capability you have there, your body's challenges with being able to breathe comfortably and easily in this position, your body's challenges with being able to orient itself over to this side as well as it does to the other side. We want to give you activities that allow you to be able to reprogram the system, all the systems of our system, to be able to create that change to allow the body to then begin to say, oh, okay, I can kind of get into this new position. I can begin to kind of find certain muscles when I'm in that position that I wouldn't normally use on that in that position, as well as I might do in the same position on that opposite side or in the opposite direction. And then it's getting the internal dynamics of the way that the body expands and compresses during breathing, and then the way that our nervous system sends messages to our brain about how to then process that new information and feel safe with it, feel like it's okay, appreciate that it's kind of new and unique, and it's not, you know, not something that we're used to, but have it feel okay in that position. So then it's not quite as much of an odd um, example to the brain about something that feels, and I'll say the word threatening, but in some ways threatening because it's too out there. How can I pay attention during my daytime to my tasks, to my work, to athletics if my body's in these awkward positions that don't feel right to me? It's a distraction. So how do we make the body and the brain be able to say, let's make them not distractions anymore? So you can access both ways of moving the body as evenly and fluidly, in particular, to transition from side to side as fluidly as possible.
So you actually did this. So Michael came to speak to my physical therapy class back in 2016, maybe, which sounds like a long time ago now to me almost. But you had us all stand up and kind of identified some of these common asymmetries that people can kind of self-assess side to side. So if someone's just sitting here listening to it, what is something they can do to stand up and kind of just see some of these things for themselves?
I will demonstrate that. I will discuss that. Let me clarify one thing first, which I think might be helpful for people to understand. Number one, as a general rule, the normal asymmetrical human, and I don't love the word symmetry, but just for conversation's sake, the normal asymmetrical human, meaning our body's internal systems, all of them, every single system, nervous system, heart system, lung system, lymphatic system, name it, aren't the same on either side. You know what I mean? There's variations and iterations that are little variations and differences between these two sides, if we want to think about things from a sides perspective. And that is based upon the way that our body is able to, number one, expand and compress or breathe. Two, be able to create movements that allow us to be able to navigate gravity, move across the ground. And three, allow our system to be able to pump. We need these things. The analogy I tell people is, if you flush a toilet and the pipe is straight down, you're not getting good pressure. If you got a little kink in the pipe as it's going down, that allows there to be pressure that can be managed, that allows force production for that fluid movement, which is all we are, is basically fluid inside. So the way that our normal internal asymmetries have a propensity to want to position themselves make our dynamics biased towards the right side. We just weight that side easier. If our body is over towards the right side, it's easier for us to breathe and for many people to process our environment and put things into place. Our left brain, which controls the right side of our body, is more logical. It's our language center. It likes to be the decision maker. And for some people, it does way more than it's supposed to, and kind of like almost disregards what that right brain, which controls our left side, is able to do. So what I have people do is, for example, let's say someone's standing now. If they were to stand with equal weight on both feet, arms are at their side, if they were to just take their body and bring their body weight over towards the right so that their whole body brings itself over to the right, so it's on top of the right leg and foot, and reach the right arm just straight down towards the ground. I didn't say tighten anything, but just bring it over to the right, reach the right arm down towards the ground while looking straight ahead, and just take an easy breath in. And do that a couple times just to see what it feels like. And then if they were to go over to the left, bring the body weight all the way over to the left, so it's on top of that left side. Same idea. Weights distributed down and on top of that left leg and foot. Left arm reaches down towards the ground. They look straight ahead and they take a couple breaths. For most people, it won't feel the same on both sides. They'll likely appreciate that when they're over towards this right side with a little bit more compression, it's just a little bit easier for air to flow. They'll feel like it feels more probably normal to them. It's like what their brain's used to feeling when they breathe. And when they go over towards that left side and create that compression and that downward positioning of that left side, that the breathing just doesn't feel quite the same. For some people, they might find it's harder. For some people, they might find it's easier. It just varies based upon their perception of what the change is, but it's typically not what they're used to feeling for a normal, quote unquote, day-to-day breath. That's one way. They can do the same type of thing in sitting. One of the challenges that I get sometimes is that when people do this on their own, when I'm not able to kind of watch how their body cheats, is that they cheat like, oh, this guy doesn't know what he's talking about. I don't feel a difference at all. But if I were to show them like, no, you're not actually over to your left side. No, you're actually not compressing that left side the same way you were on the right, even though you think you did. Does that make sense?
Mm-hmm.
Or you turned
Yeah.
your head a certain way because your brain's like, that's just too odd for me to do that. There's compensations, again, and strategies the brain puts in place, in particular with strong athletic people. They'll try to muscle their way over there. But that being said, that's part of the orientation of the way that we, as a human system of systems, have a propensity to then arrange our body during the daytime. We are, as a general rule in my mind, based upon everything that I see, I say sided, not handed, a right-sided species. We are better able to orient our attention over towards the right side. The visual system, the way that we look at our visual field, not clarity of vision. The way that our body processes information coming from that right side of the world compared to the left side of the world. The way that we're able to kind of orient all of our insides and have a propensity to kind of like put them over and on top of this right side. and then be able to, again, do tasks during the daytime is just easier for pretty much everybody that I see. And people who even say to me, you don't know what you're talking about. Like, I'm always on my left side. I show them how their body has just developed varying compensations or varying um, laxities, pathologies of sorts, do you know what I mean, to try to override this underlying mechanism. And even people who are left-handed, it's not a there's not better or worse, it's just different. And even people who are left-handed or identify themselves as left-handed, many times if you talk to them, they'll say, well, yeah, I write and I throw left-handed, but I do everything else right-handed. Or, you know what I mean? So they identify themselves justifiably as a left-handed person, but it's just genetics, it's processing of the brain, you know what I mean? It's just a different way they've done stuff. Because as a general rule, our body has a propensity to understand and appreciate how to orient towards that right side just a little bit better. Some
Mm-hmm.
people significantly, other people just not as much.
Yeah. And um, there were some other things too. Like I've looked before online, and there's something with the foot and the toes, how the toes play can show you like there might be some asymmetrical pattern you're using too much or compensating with.
Sure.
Um, I think the other big one, are there certain things that people might be experiencing that is common to something a PRI pattern would be part of a PRI pattern that they could self-identify? Like one I've seen before was, and I think you brought this up in the lecture we had, was like the pants and the t-shirt line around the waist is always crooked.
Correct. Exactly. There's a long list. Do you know what I mean? There's a long
Yep.
list. And so, at the risk of not feeling like I leave anybody out and not
Yeah.
getting something that addresses them specifically, certain things are not uncommon. Number one, if someone were just in standing to feel where their weight is through the bottom of both feet, let's just say that. Some people will say, well, I feel like I have more weight on one side versus the other. Many times, people, when I bring it to their attention, will feel that they have more weight over towards their right side if they really think about it. Two, they may feel, oh, I feel a little more weight towards the outside of the right foot than the left side. Many times, because if the body's trying to be over towards that right side more, it will have a tendency to, again, not everybody, but have a tendency to be more oriented towards the outside of that right foot. Some people have done it so right-sided so much and are so strong in their patterns that they've actually taken that right foot and ankle and kind of cranked it inward as another layer of compensation to adapt to a foot and an ankle. Does it make sense? That's too far over to that right side. The ability to feel like if they're in a kind of like a parallel position with their feet, and if they put their left foot a little bit behind their right foot, like 4, 5, 6 inches in a parallel position with feet shoulder distance apart, and then squat with their weight over towards the left versus same thing on the right side and squat with their weight over towards the right. Many times they'll feel a difference side to side. Some of the more obvious ones people will see is shoulder heights, and how that shoulder is typically is more lower on the right side. I hate to say shoulder, but that's what we'll see. It's the right side being a little bit lower on the right side than the left. And you and I probably learned in school that, oh yeah, it's because it's the dominant side is down. Well, that's not accurate. I'll see lefties all the time that are down on that right side. And it's a body that is just arranged over towards that right side. And then again, it's not everything's right. It's just what other things have then twisted and turned and compensated further up the spine and the rib cage and the head and the neck to adapt to that orientation change. Sometimes it's a forward head position. Sometimes it's facial asymmetry. People who look in the mirror can like, why can't I smile the same on both sides? Or why do I have a crossbite? Or why does one eye look a little more open than the other? And so on and so on. There are some not uncommon and fairly predictable presentations that we can see with some of these. These are more visual representations of some of those imbalances that are happening internally that drive some of this stuff.
Now, can resetting some of these breathing patterns start to change someone's facial complex?
Um, Here we go. Yes. Here we go. Yes, absolutely. And like-minded practitioners respect and appreciate that. Don't read into that statement. Do you know what I mean? Otherwise, the medical community will be like, what are you talking about? That can't happen. Well, I see it happen every day. The guy that was just here, I keep pointing to my table over here, that I said, let me take a picture of your face. He's like, oh my gosh, my eyes are wide open now. It's like, they're usually slits. I'm like, yup, because changing the way that the system is able to expand and compress. I keep using those words because that's breathing, but breathing regulates everything in our body. But it's about, can we get a system to expand and compress? The cranium is supposed to expand during inhalation and compress during exhalation. The rib cage circumferentially should expand outward in all directions and compress inward roughly during breathing, as should our pelvis. And so by putting people in certain positions, by teaching them, frankly, sometimes not even putting them in certain positions, but sometimes just getting them to learn to go through a fuller breathing excursion to restore a baseline of the way that internal dynamics take place, which won't feel normal to them, require a lot of thoughtfulness to be able to reproduce it, because the brain's like, don't do that. That's not what I ever do, is a challenge, as it was for this person. But how then it suddenly is like, oh, it's allowing the system to be able to have all those expansion and compression regions that I just talked about to be more balanced, so that expansion and compression is happening in a more balanced way in those three big, it's all over the body, but those three big structures that are the primary breathing apparatus. That's our axial skeleton. It's what it all comes from. You know what I mean? And so by getting that change in dynamics, which is what I work on with every single client I see, whether they're here to see me for plantar fasciitis or headaches and neck pain, I'm going to do something that's going to be related to restoring and balancing out those normal internal pump dynamics, because that, it will absolutely change the resting position of structures, tissue tone. My manual techniques, I don't have to do half the stuff I ever used to do, because the system's allowing the body to be in a better position. So connective tissue, joint structures, fluid distribution within joint structures are able to be more balanced. So I don't have to do as much work that way. Does that make sense?
Absolutely.
Or clarify, should I say?
Yeah. I think a lot of people too, and sometimes people come in, and we've seen plenty of people with headache, shoulder pain, hip pain, whatever. And it's like, we'll identify some type of breathing dysfunction there, maybe not as far down these patterns that I could go as you could, but there's still things there. And people are like, I don't have a breathing problem. I'm breathing just fine. And I think people need to realize, how many breaths do we take per year, Mike?
Well, interesting. So I'll call you on this. I don't know.
Yeah, there's a difference.
And neither did Dr. Candula, did he? So we talk about per day. Yeah. I just talk per day. So 20,000 to 22,000. I mean, same time. I heard your podcast. Nice job, by the way. He did great work. But my point being is I'll reference people to that one, because he went up and down about airway and importance of understanding the value and health epidemic it has on people. So to your point, 100%, there's elements of that piece that is constantly being reinforced, and the brain wants it to be easy. The brain wants it to be comfortable, and it wants every breath to be similar to the one it just had. Because again, anything that doesn't feel like that is going to be a distraction, and it's going to kind of take away from what we're dealing with at that time. And if I've got all those imbalances taking place, then that neck and that cranium in particular at the base of the skull, where it meets that neck, which is our breathing center, the pons, the brainstem, our deep brain, that will get compromised. We're going to start getting disrupted signals. Cranial nerves start getting compressed. Vagal nerve goes in. You know what I mean? But all these things become dysregulated. And to your point, and this is why I just like words matter to me. I always talk to people that say, we just breathing imbalance. That's actually the word that I use, because I don't want to say dysfunction, because it's not pathological most of the time. It's just imbalanced. And so imbalance, I feel, is a much more approachable word for them to understand that, okay, it's imbalance. That's cool. How do we fix that? Versus dysfunction is kind of like, well, why didn't my doctor talk to me about this? I had
Mm-hmm.
somebody in yesterday. He said, I can't go to my children's pediatrician's appointment anymore because my pediatrician says that nasal breathing is not a big deal for the growing youth, and like it doesn't really matter for kids. He's like, how can I understand and respect this person when they don't respect and understand how important this is for people? And that's representative of our medical community. So yes, to your point, in my mind, each person has some compensations that they've put into place to allow the system to be able to stay alive. And I'm not trying to be graphic, but that's literally what it is. I won't let you die. It's called sleep apnea. I will wake you up to keep you alive somehow. And so those are things that we begin to do to allow the system to be able to do it easier. But then again, the diaphragm mechanism, the breathing apparatus, the nervous system response to all of these things are so intertwined and interconnected with each other, and are based upon electrical signals, and you know what I mean, and like vibrations and frequencies inside. That's part of every single message that's being sent to our brain and body get disrupted if it's not in an ideal place. And the
And
goal of what we want to work on is not to have anybody find one place that they're in all the time. That's not what I'm looking for. I want to have them find that range, that zone. I call it the flow state that allows them to move through and around a balanced position. That allows them to be able to go get it jacked up when they go to begin to train and work heavy, but allows them to be able to kind of revisit it, to restore, to replenish, to sleep. It makes sense, to recover in a balanced way.
absolutely. And it's just the fact is, if we're breathing 22,000 times a day suboptimally, yes, you can breathe and you're here and you're alive on this planet, but we're probably not thriving as individuals at that point when breath is our number one piece to life. Yes, you will stay alive during sleep, but we're not sleeping well, we're not breathing well, we're not performing well. There's something more we can tap into there if we can restore some
Absolutely.
of these patterns.
And most people are over breathing. And by over
Yes.
breathing, I mean, if you go to the doctor and the norms, quote unquote, are like 12 to 16 breaths per minute, but ideal is below 10. We should be breathing less. And when a body is in a good, like I keep saying balance, but kind of that middle of the road, as I mentioned, state, able to do it in and out of the nose as much and as often as possible, day and night, then that breathing will slow down. The chemicals are being released in a balanced way. That nitric oxide that's produced in our midface that keeps our brain happy, that keeps it regulated, allows our body to have homeostasis in our breathing mechanism, the respiratory center, and our lungs, and we swallow it with our saliva, so it gets into our digestion system, you know what I mean? All that stuff that's produced there can do what it's supposed to do to allow the system to be able to better regulate itself, let alone position itself during the daytime. So that's part of the goal of what I have people do above and beyond positional activities and breathing activities, to say, don't look at this. If I say breathing, just think about getting your body into a better position. That's all I'm talking about, is get it to a place that allows you to be able to get out of the heightened state that it's in, that we all live in all day long now. This is not how we evolved. You know what I mean? That we've just adapted to. And some people, they just have not been able to adapt to it with as few problems as others. Other people are adapting to it, but it's still not ideal.
Yep. And so, from my understanding, there's kind of two of the most common patterns you guys tend to have with people. There's that left, what we call AIC pattern, and right brachial chain pattern, correct?
Um, yeah, so I know what you mean by you guys. I mean, it's the people who understand posture restoration, those chains of muscles. Absolutely. So what the institute has identified are common muscle common muscle and tendon connections that are kind of interwoven on the inside of the body that work in response to everything that we just talked about. There's certain connections of the right diaphragm and the left psoas and the right adductor, you know what I mean, that are just, they have a tendency to work in a certain way based upon these imbalances differently than the other chain of muscles that are all interconnected do on the left to right to left side. Does that clarify that piece? So that anterior interior chain is referring to, or AIC is referring to the internal mechanics of the way that's anterior to our spine, interior meaning inside our body, that chain of muscles, that connection that they have through the diaphragm that works through our skeletal structure down through our pelvis and sacrum and legs, orient the body towards one side a little bit cleaner and easier than that opposite side. And that's referred to as the left AIC, meaning we want to have the same, let's just say, connection of groups of muscles, be able to do the same coordination of movements towards the opposite direction. And then that right brachial chain is similar. I mean, it talks about the brachial aspect of our upper chest wall, and that the right brachial connection of muscles in that region that involve the neck, involves some of the chest, and then again, the diaphragm is more biased towards most people on towards one direction than it is towards the other direction. And there's one up in the head and the neck as well too. And so they call that one, when they talk about left AIC and right BC, they're identifying groups of muscles and tendons that have a tendency to all work in a very strong, well-coordinated way. And I say well-coordinated, meaning too well. You know what I mean? They become too, what we call dominant. They become too strong in the way that they have a tendency to, I'll say, pull on the body. But there's a lot of compensations that come off of those. Do you know what I mean? So I don't have people feel like it's like, one or the other, and that there's this internal battle between these chains of muscles that's ongoing. It's more a matter of those are ones that are most commonly coordinated to work together, that feed into some of these imbalances and these dominance of positions and breathing patterns.
And so someone that's experiencing this, these patterns being a little too dominant, or maybe it's inhibiting something else. So for a lot of my audience, they're powerlifters, weightlifters, athletes. What would someone experience from like a performance realm there, that this is something that might need some intervention with?
Well, and therein lies the rub. That becomes the big question that a lot of professionals have. Is it's kind of like you look at a top level sprinter and you look at their sprinting mechanics. You're kind of like, wow, holy cow, they're getting away with it. Do you want to mess with somebody who's gotten really good at what it is they do? And so, one could argue, if you would, sure, you want to kind of look at some measures and take some interventions that allow those measures to be in a more balanced position. And you could very easily say, well, I don't want to take away what's allowed them to be successful at what they do, because then you might begin to kind of then mess with their ability to compete or do what it is that they want to do effectively, if that kind of clarifies that answer. So I don't think there's a wrong camp. I just think it's like, what do you feel is going to be most successful? The bigger issue is what are you dealing with? Are you dealing with chronic low back pain after you lift? Are you dealing with, let's just say, impingement of a hip? Let's just say, are you dealing with a chronic tendonitis in a shoulder, or some itis of a shoulder issue?
All my patients are saying yes.
Yes, exactly. So to that point being, yes, as a general rule in my mind, I would want to have them, take that back. What I work on is I want to have people understand and appreciate that there are likely some things that can be done to allow, let's go back to those chains of muscles, since we're on kind of like a PRI discussion, if you would, those balance of those muscle chains to be able to have better capability on both sides, to be in a little bit more of a balanced position. I don't want to make somebody perfectly balanced all the time. That's not how we work. What happens with our body is our body needs to go through cycles. Everything cycles. We go through nasal cycles. We have a more dominant nasal dominance, not just nose itself, but like deep inside that mid-face area, the eyes, the deep cranium. That goes 90 minutes more towards one side, cycles back to it's more towards the other side. You've got congestion that goes back and forth. We have breathing patterns that are more dominant. We have nervous system, like a circadian rhythm. Like everything's a cycle, everything's revolving. And so part of the elements, going back to your original question, is can we get the body to be able to cycle towards both sides more effectively, while appreciating that cycle means there's still dominance. There's still something that's going to allow it to create propulsion, to create push. You know what I mean? So if I have my system that's perfectly balanced all the time, I may not be able to get the drive off I need off a stronger dominant side to lift that weight up overhead, to be able to get into that deep squat position. Making sense? To be able to maximize that catch. What I would want to do, though, is have them be able to find certain positions, restore the capability of being there successfully and finding other muscles to be able to do that more effectively so they can access both sides a little bit better. They can find muscles that maybe aren't quite as active on one side as they are on the other. Some common ones, left adductor region, the left inner thigh region, as many people just doesn't have as good access on one side as it does on the other. Vastus lateralis dominance with people, meaning that lateral quad muscle on the outside that's doing way too much work because it's positioning a pelvis and it's driving the way that the femur moves itself inside there on one or both sides. Again, I keep going back to the person that was just here because it's a good representation. The person that squats and comes up and their butt cheeks are like totally engaged before they squatted and as they finish, like they're over engaged. It's not glute amnesia. It's not even good positioned glutes. It's called a body that's not well positioned. So their glutes are hanging on for dear life. It's actually the deep sphincter, you know what I mean? That's actually producing the problem. Are people over pushing knees out when they get deep into the catch or deep into a squat position to try and compensate for what they don't have inside a pelvis or a hip region? Does that make sense? And so on and so on. Are they thrusting their chest and body into a position to be able to get that overhead position that they're looking for because they don't have the requisite control and positional ability of that upper quarter, meaning rib cage, scapula, arm, the whole package to position itself underneath that as effectively? Does that head jut forward when they go to overhead press because they don't have the movement and the capability of establishing it in that upper part of their body? So they get it by moving their head and neck into a different position to create rotation somewhere else to allow it to happen. I hope those examples help kind of describe that a little bit.
Yeah, absolutely.
Because you see it all the time, probably some of the lifters you work with.
Oh, absolutely. Yeah. And so how does anatomy play into this too? So this is another thing is, we see a lot of people, I work with a lot of hockey players, weightlifters, powerlifters, CrossFitters, things like FAI or femoral acetabular impingement. We see cam lesions, pincer lesions. They don't always matter, but sometimes structure can dictate function. How do those play into a PRI-based system approach?
So in my mind, and again, I always want to speak for myself. So in my mind, the way that any of those, let's say pathologies, because you kind of listed like FAI, it's a pathology. So let's say a hooked curved acromion in the shoulder, you know what I mean? So something that's created some bony or joint change that's happened over time as a result of chronic stressors and imbalances placed on structures have now become problematic to the point that now there's changes. Does that clarify that? Is that what you're kind of asking? Okay.
Yeah.
So it feeds into it, meaning that the body is constantly creating adaptations to the stressors that it feels. So, joints shouldn't be getting into positions that allow them to get over twisted and over compressed too much. If they do, problems are going to develop. We need impingement. I know that sounds like a weird statement, but we need impingement. We just need balanced impingement. Because if I don't have something that's going to allow the body to sense that there's an element of what it's able to feel to push against, it's not going to be able to have anything to then release from. You with me? So like a joint compression and opening, that element is part of what we need. If those imbalances that are happening, let's say in the pelvis and a hip joint, to your point, specific to the FAI, and there's developed these little twists of the tissue, meaning that the fascia, the connective tissue that surrounds our structures has kind of gotten all twisted into a position, kind of like tucking your shirt in funny, and how it's kind of like, whoa, man, every time I move, my shirt's kind of pulling me that way. That begins to affect the way that those joints are able to move. And so then you're going to have imbalanced impingement. Now you're going to get structures that are twisting and turning into directions that are creating more load into an area. So the activities that I go through with people that are designed to try to address imbalances that I see, again, let's just say specific to the FAI, where I assess the pelvis resting position. Pelvis meaning those two pelvic bones, what we call those innominates, that hold the socket for the hip joint. How I assess the femur's ability to move inside those sockets, and being able to check different directions of movements and what moves well and what doesn't move well. Being able to kind of feel and sense and assess the way that sacrum is resting between those two pelvic bones. Then I begin to create interventions that are designed to try to help to provide changes in that limitations that they presented to me with. So if they don't have good movement towards a certain direction, for the sake of this conversation, let's say flexion, meaning a leg coming up towards them, or being able to have a thigh bone, a femur, be able to move away from midline or AB duct, or move towards midline, meaning AD duct. Just to be clear, there are no planes in the body. That's just for conversation purposes. Everything's kind of open. But for assessing purposes, if I see there's limitations in those, and in particular, if they have symptoms and or changes in that area, such as an FAI, like on X-ray, well, then I want to do what I can to allow as much space for things to move. So I want to then give activities that are designed to create more balanced space to take away those little torques and torsions of that area, so that there's more, let's use our language, open pack position, if you would, for those structures to move so they can slide and glide easier. I have a number of clients that I work with that have labral tears and FAIs that show bony changes in cam and pincer and all that stuff, that do really well and are really active because they've maximized the ability to restore that good position to allow that space to occur, so that they're like, you know what, I might, maybe in the future I'll think about doing something, but I'm actually doing pretty well. I don't need to jump into a surgical intervention. And to finish that point, if they do need to have some surgical intervention, because sometimes you kind of need to, they're in a better position to recover afterwards. The number of quote unquote failed hip surgeries, rotator cuff surgeries that I see because people were never in a good position to start, but they have a surgery to address pathology, but they go right back to their patterns and their movements and their imbalances, creates, again, quote unquote, failed outcomes.
Yeah, I just had one of those. So a friend of mine came to me with some FAI-like symptoms or TFL tendinopathy type deal, and he's got a complex medical history too with back pain, and he was hit by a car as a kid, and he broke his femur. So there's all these little complexities to him, and he had gone to a surgeon like, yeah, you have a small labral tear and you have a cam lesion. So I think I'm going to get surgery. I was like, this isn't adding up. Like, even your scour test and the things we would typically do to say, yeah, you know what, that could be problematic. Maybe it's part of the picture. He didn't have any of those traditional signs. He just kind of had anterior hip pain, and he always has a hip shift when he squats. And we did a couple things to try to figure it out, and it didn't get better. But I actually went to his surgeon with him and was like, hey, I don't think this is this. He might have hip dysplasia. He's got some of those common signs. And the surgeon just kind of threw my piece of paper out and was like, yeah, well, we could do surgery because you have a cam lesion. It's like, well, what about XYZ that's here? And he's like, oh, yeah, we should investigate these things further. Anyways, he ended up going, and still he felt like he was lost and hopeless. He's like, the doctor said the surgery would work, went and had the surgery. And now he's having even more pain, and still the same pain than he had before the surgery. So his
system was assaulted on top of having already underlying issues. 100%. Yeah. Good example.
So maybe I'll send some patients up to Maine.
Yeah. Love to have them. Well, and that's, I think one of the things that I'll hear from people, like I'll get referrals from colleagues, other PTs and stuff like that in the area, and they'll say, oh, I think this one's, and these are the words they'll use. And it's okay. It's fine. I think this is a PRI person. It's kind of like, and that's fine to say. But to me, the way that I look at, and part of the conversation I'm trying to kind of get across, is that it's less about one organization or institute saying this is the way things are. It's more a matter of, let's look at the physics and the physiology of the human system. and its complexity and the way that it has a propensity to do things, and that there are certain common presentations that will happen as a result of that. This particular organization just happened to kind of create some labels of sorts, acronyms. Who doesn't? You know what I mean? SFMA, FMA, name it. They all got acronyms. And it's not one's better than the other, maybe necessarily. Everybody's talking about the human structure, but it's which ones feel like is more representative of those internal dynamics that are by design, every breath you take, asymmetrical. And again, I use that word kind of carefully. Imbalanced. It's okay until along that spectrum of life, those imbalances are too much. And this person that you refer to justifiably is like, well, I mean, this guy's the surgeon. I mean, I love you, Brett, but I mean, this guy's the surgeon. He's telling me this is just going to help me, you know? So, and that's part of what is a challenge with some of our world is to have them say, like, just give me a couple of months. You know what I mean? You know, just work with me here. And part of my interventions that I work on with people is behavior, is sleep position. So my questionnaire goes into all of these things. Like the guy that kind of came in and I find out more of his history. I'm kind of like, oh, you had braces 3 times? Oh, you had your tonsils, your adenoids, you have apnea, that's part of my questionnaire. And he's here to see me with low back pain. And they're kind of like, why does that have to do with anything? I'm like, it has everything to do with things. You know what I mean? That's part of that, the detective work that I love about what I do. And so that being said, again, we're going back to kind of the quote unquote, what I mentioned before about the PRI, they're a PRI person. It's like, well, they have imbalances that everybody else has. But if you feel like the approach that I take, which will be different than the traditional standard model of looking at things the way that was done, then absolutely send them this way. I want to give them what I can introduce to them. It is an ongoing body of knowledge that the Institute offers, which is why I'm a student of it, as well as many other methodologies. I want to be clear, okay? But I'm a student of it because they continue to provide dialogue, courses, conversations, webinars, things like that, that are deeper and deeper dives into our complexity, into our growth and development of the human system, evolutionary changes, how we've gone through, you know what I mean? Like stuff that I love to learn about that help fill in blanks for me for when I'm working with people as to kind of like, oh, okay, it answers more questions for me. And it also allows me to be able to have a better dialogue with those people that have more questions and want to learn more about it. I see some people once a week for years. I've seen them. And half the time we're lifting weights and training. Other times we're on the table. Other times, literally, we discuss for an hour stuff. And I talk about ADLs. We go out to their car and look at their positioning, how they sit in their car. We go for a run down the street. You know what I mean? Like we go through stuff to kind of teach them how to use this amazing vessel better and understand how to use it better.
So you talked about that, and that's something we do a lot too. With, if you have back pain when you're sitting all day, well, let's look at how you sit all day. If you have pain driving, let's go out and see how you get in and out of your car and what your setup looks like there. Are there certain things you guys do differently? Like the way I have been trained to do it is basically, if someone has more of a low back flexion sensitivity, and they can tolerate extension better, well, I'm going to have them sit more in extension so we're not picking a scab or a trigger. If they have a lot of neural tension through their arm or their leg, like let's sit closer to the wheel and the pedals so we're not just cranking on a nerve. But are there certain PRI thought processes about these ergonomic setups that people might want to consider for breathing purposes?
Sure.
Or
and again,
living?
I know I keep saying this. This is just me, kind of like, this is me. Okay, this is my interpretation. It's not me in one camp, just to be clear. So it's me and my interpretation and explaining some of the biases that are what the Institute has discussed and talked about that might not be talked about as much, if that kind of clarifies that point. So one being, like I'm demonstrating this, people can't see it, but I'll kind of walk you through it so you can see, so it makes sense.
This will actually be on YouTube, so people can watch it if they want.
Great. Oh, good. Awesome. Perfect. Thank you. So number one is when we begin to think about things as flexion and extension, we're going to get stuck. And I'm not giving you a hard time, Brett. You know that, right? So we begin to think about one or the other and which one they like better, and think about it strictly from a planar movement perspective. It's not going to be a complete representation of the way that the body works. And that's just, I want to have people find more comfortable positions. But the reality is that how we do stuff when we're more stationary, sitting or standing, is the bigger deal. And it all goes back down to the way that our insides do stuff when we're in that position. You with me? Because again, going back to that 22,000 times a day of us breathing a certain way, we have to be doing when we're sitting or we're standing or we're doing stuff. And so the common conversation that people talk about is, well, I have terrible posture when I sit, and my shoulders are rounded forward, and I have forward head posture, and all these classic societal discussions is less about that position and more about your body has just adapted tissue length changes and internal ways that the body positions itself so it breathes easier. Again, it wants ease. Does that make sense? So what I'll have people do is in a sitting is just, if they sit, number one, most of the time, if I'm in this chair, people are going to try to find the back of a chair. Why? Because it's there. Why wouldn't they? And you can see from this chair that this chair is somewhat reclined and rounded to, I joke with people, lure me in for me to be in this position. Can you appreciate that? So I'll have a tendency to sit like this. So I'll find and contour my, whatever part of my back can feel that back. And it's the same with a couch. It's the same with a work chair of any kind, to be able to allow it to, quote unquote, support me. If I'm in this position, if I take a breath, I can't expand back. Does that make sense? So I can't get the rib cage to circumferentially expand outward. It's supposed to go back just as much as it's supposed to go forward. Our whole chest wall is filled with lungs, except where our heart is. So this back expansion is very important for people. And so if I'm in this position, I'm going to have a tendency to breathe just up and forward. So first thing I have people do is slide their hips underneath them. And I'm working on trying to get their sits bones, their butt bones, right underneath their body so that they're right on top of their sits bones. I tell people your sits bones are your heels when you're sitting. They're what you're, quote unquote, standing on. And now in this position, I'm going to feel this back against my back, but I'm not leaning back into it. I'm not in this reclined position. I'm just allowing it there just to give me a little bit of, I'll use the word support, but just a little bit of support. And then in this position, I want their feet flat on the ground, so they got good grounding in this position. And I work on having them take a few breaths in this position. Slow, I tell people, in through your nose. Feel things expand outward in all directions. Feel the weight through your sits bones. Feel the weight through your flat feet on the ground. Exhale, a little more air than you normally would, not forcefully. Don't change your position, but just stay in this position and exhale more than you normally would. Pause for a couple seconds. Slow with your inhale. So I typically have people reset themselves by getting them right on top of those sits bones. Again, whatever back they have, that's great. Let it be there for contact. But I'll even tell people sometimes, like with driving or sitting in their workstation chairs, like breathe into the chair. So they learn to get that posterior that expansion backwards. Do you know what I mean? To allow that to open up. Take your time when you do that. It's a nice, easy exhale. Exhale more than you normally would. So, it's what I call a 5-breath reset. I have them do about 5 breaths that way. If they're sitting at their workstation periodically, when they're doing long car rides, if they're traveling on an airplane, if they're standing at their workstation. So to me, that's allowing the body to be able to get that to open and close more effectively in all directions to allow them to get themselves more centered. Okay? That's kind of number one, to reset. 2, I tell people, is I want to have you appreciate that we're supposed to move. Everything inside our body is constantly moving and constantly vibrating, period. So assuming positions that are ergonomically what the society says are sound, do you know what I mean? 90 position, back support, all these things to get the system to not move less, more and more is more and more problematic. So I'll have people say, I just want to have you just shift your hips, meaning slide one thigh forward, slide one thigh back. Just give your body the contact with those sits bones, feeling them on the chair, and then slide forward and back. I don't care, 6, 8, 10 times, something like that. It can be an odd number, 7, 9, 11. You know what I mean? But just to get that movement, like you basically just took your body for a walk. And you can see I'm not working hard at it. I'm just moving a little bit back and forth. For those that have a strong bias of a position of the body, meaning they love the right so much, many people will present that way, that they're just over towards this right side. You can see me doing that now. It doesn't look like I'm much, but I'm over towards this right side. They'll sense and feel more weight through that right sits bone and back of their thigh. They might feel more weight on the right foot on the ground, or more towards the outside or the heel of that right foot on that right side. When I see people have a strong bias in that position, I give them the same conversation. Get the hips up underneath you, take a few breaths, but then I just have them just bring this left thigh and pelvis and rib cage back a little bit. Just shift the weight back a little bit on that left side and bring your body weight over towards the left a little bit. Just make your body just a little bit cockeyed the other way, just a little bit. Stay there and just take a few breaths as you answer the email, as you know what I mean? You listen to your voicemail, whatever it is, and their reposition of the body back and back towards that left side a little bit, and that shifting of the weight over towards that left side a little bit, with the head being, vertical, looking at their computer screen, looking out the dashboard, taking a few breaths in that position, will likely feel different to them than they're used to, and will take some thought to be there. And then usually by the, fourth, fifth, sixth breath, something like that, like, oh yeah, it's easier that way now. So I tell them, I want to have you revisit this position periodically during your daytime, because the body will have a propensity to, with pretty much everybody I see in some variation, want to do it the other way. Another very telling example I'll tell people is, sit on the front edge of your chair, put your right foot just a little bit behind your left, kind of underneath your knees, stand up from the chair with your weight towards the right, and then sit back down with your weight towards the right, and make a note of what that feels like. And then switch your feet, put your left foot just a little behind the right, again, not directly behind for those that can't see, but just a little bit backwards of the right. Bring your weight over to the left, like I just demonstrated, and stand with your weight over towards that left, and then sit with your weight over towards that left. Many people will notice a difference. I'm not kidding you when I see people unable to get out of a chair. And I'm not talking about people who are frail and elderly. I'm talking about people who are so strongly positioned and dominant in their patterns that they get over here and like, oh my gosh, holy cow. And they're shocked, because even though they may say, well, I always get up with both legs, they do some variation of orientation towards that right side. Does that make sense?
Yeah, absolutely.
I'll even have people do this. So let's say, get over to your left and reach your right arm up in the air as you go to go. Just get the whole body to learn to change the way that it does things, so it can then begin to get better awareness and capability of the brain and the body to be able to change the way that it has a tendency to want to orient itself. And I work on how they do that in standing during the daytime and in sitting and things like that. But in my mind, going back to the original part of the conversation, it's, I want to get good balanced breathing periodically at their desk. And if they can't get up and walk down their hallway periodically, just give yourself a little shimmy. I say, I want you to be a desk jockey. I want to have you feel like you're kind of going side to side. You're kind of going up and down at your desk, because it's going to allow things to kind of pump and move a little bit better.
And so we got to wrap up here in a minute, Mike, but are there certain take-home messages people should take on breathing and posture and being able to breathe better, thrive, and perform a little bit better? What are some things people should do? What are 3 or 4 things people could do?
Great question. So number one, for those that are interested, learning to educate yourself a little bit more about it can be very, very helpful. You alluded to the book Breath, I think, in that podcast I heard you do with Dr. Candula. It's a good starting point. I'm really glad it came out. It's nice to have something come out a couple of years ago that suddenly kind of brings validation to things that I've been talking about for over 20 years now, that are bring it to the mainstream. Number two, and there's articles and more stuff coming out that you can read that kind of discuss those things. Number two, appreciate that, and I believe very strongly about these things. And this is me discussing things. Like I mentioned before, every single person I see has some breathing imbalance. I have my own. It comes and goes during the daytime, but it's, can you learn different ways to try and help to revisit and restore a more balanced breathing mechanism during the daytime? For some people, it's meditation. For some people, it's 4-7-8 breathing or box breathing. I'm just throwing those out there. You can look them up. You can find them online real easy. For some people, it's Wim Hof. For some people, it's yoga. I mean, there's various ways to have people begin to explore and appreciate and understand and feel and sense the importance of that breathing apparatus and how much it plays a role in our entire perception of our surroundings, let alone just day-to-day breathing capabilities. Number 3 is that the common understanding and representation of posture, I'm a big air quote guy, posture that is in society, I don't believe is accurate. The concepts related to stand up straight, shoulders back, tighten your abs, like hold this stiffness, this rigidity. Same type of thing with balance. It's just been misrepresented. I don't think it had ill intentions, but misrepresented. Balance, bring one leg up, stand as still as you can. That's not how we work. We're supposed to be this fluid moving mechanism. This, as I mentioned, this organism that is mostly fluid, being able to do stuff. But can we get the system to balance all of these things? The head on the shoulders on the hips. As I mentioned, your sits bones as heel bones when you're sitting. Your body be able to kind of get your center of mass, meaning your guts and your pelvis and your hips. Just put them underneath you so that you can be in this position. To me, this is good posture, where I'm in this position where my body's wobbling. You can kind of see I'm able to kind of move in all directions from a center area of sorts. But in this position, I can also expand and breathe circumferentially and maintain this position without having to assume some other position to allow that breathing mechanism take place. And similarly with balance, can we get the body to arrange itself on top of things and appreciate that if I'm doing balance work or single leg RDLs, can I do it and allow my body to wobble a little bit? Because the wobble is called recovery. It's called managing balance, not creating stiffness. And from a weight training perspective, all those concepts are, yes, I want and need stiffness the heavier people go. So I'm talking about restoring a system to a balanced state for day-to-day life versus the stiffness, the rigidity, the overact, that activity, that forcefulness for force production. We need to lift heavy and to do hard things, but not lead our life that way, not go to sleep that way at night. You with me? Not go home to our families that way in that jacked up state that we're just used to. We don't know any different. But how can we get the system to down regulate itself afterwards and be able to kind of create a better brain and body balance that allows it to be able to feel safer, more relaxed and more chill, so that we can then begin to back to day-to-day life more effectively. Long answer, but I hope that helped.
Yeah, that last piece could be a whole nother podcast I'd like to talk about, with seeing the differences in, there's very similar training aspects of weightlifting and powerlifting, some differences, but the way I see a common, especially with males, you'll see it more pronounced, of the stiffness and rigidity a male powerlifter will have versus a weightlifter is just interesting, but it's a different demand. They have to, right? But it's like, is there a way, and it's an adaptation for a sport we want to see, but do we need to live our entire life like this? Can we come out of this? Can we just turn it on when we need to? And is breathing a strategy someone like this can utilize to come back down to baseline after a training session and restore normalcy and balance?
Yeah. And I mean, everything has consequences. And if that's the goal of what you're doing, that's awesome. Okay. It is. If we can have it knowing that that's the end of the spectrum you're moving towards, that high end of that spectrum, we can't bring you all the way back the other way, but can we just bring it back a little bit, dial it down a little bit so it's not so prevalent in how your system deals with day-to-day life, because you can't have homeostasis living that way and sleeping that way.
Absolutely. All right, Mike. Well, where can people find you?
Well, I see people out of a studio at my house in Cumberland, Maine. which is just about 15 minutes north of Portland. I lecture pretty regularly. I do online consults and mentorship programs for people who have an interest. My website is, everything I do is MJMATC. That's my Twitter. That's my Instagram. That's my website. And that's just, where I kind of put ideas and concepts down. I have I have a whole nasal breathing podcast I did for an organization that's on my website. I got a whole posture webinar I did. So I got some other resources on there if people want to learn a little bit more about some of the stuff that I was referring to.
You'll definitely have to send me that one on nasal breathing because I suffer. So
yeah, awesome.
Are there non-surgical interventions you have for me that I can then I could utilize if I'm looking at a turbinate reduction surgery?
So I didn't get a chance to listen to the entire conversation you had. I don't know if it got down to you with your conversation with Dr. Candula, right? Yeah.
Yep.
Number one, I'll kind of speak quickly. Number one, there are things that can be done with number one, practice. You know what I mean? To be able to allow the body to be able to learn to genuinely breathe through the nose better requires practice. It requires consistency. Sometimes requires nasal strips to kind of get the nose to be open. Sometimes does benefit from, and if I say mouth taping, I'm just talking about getting people out of the behavior of breathing through their mouth if maybe they don't need to. They take 1 or 2 breaths out of their nose, like, oh, I can't do this. So they just default to the mouth. But it's like, no, you actually might be okay if you give it time. Sometimes different types of nasal sprays can do a really nice job of opening up the nasal passages enough to allow more space periodically be done, kind of morning and night. There's a couple that I like that are non-steroidal that do a nice job of kind of getting that flow to happen, making sure that allergies are being addressed if they got allergies. You know what I mean? So, and frankly, sometimes seeing like an osteopath that specializes in cranial techniques to help to kind of get those cranial bones and those cranial structures into a more balanced position to allow as much space as possible can be very, very beneficial. And I have had people who have been scheduled for surgery. It takes time, right? To be able to kind of put the efforts into place to make the changes can be quite beneficial. And just like we talked about before with the FAI, even if not, your outcome will be much better because everything else is in a better position and the habits and the behaviors and the positions have all been better restored to begin with. So an outcome is just going to be that much more successful.
Cool. All right. Thanks, Mike. Well, we got to wrap up here, and thanks for coming on. Appreciate the value and the knowledge that you've shared with us today. So hopefully we can have you on some other time and we'll talk about stiffness and powerlifting and restoring
Sounds
normalcy.
Good. I enjoyed our time. Thanks for the opportunity, Brett.
No problem.
Yeah, cheers.